Hi, I'm Dr. Amanda, and I'm an orthodontist. I'm also the CEO of StraightSmile Solutions. We help dentists all over the world understand orthodontics better. We work with all systems, braces, appliances, and brands of aligners, and we support all systems and brands. This video will share content that is the property of Invisalign and Align technology. We've made this video upon request of 40,000 plus doctors, subscribers, and followers to help them achieve better outcomes with their Invisalign cases. We do not work for Align technology. All opinions expressed in this video are the opinions of StraightSmile Solutions and not Align technology. Thank you to Align Technology for continuing to support us educating and helping their doctors and letting us share this video around the world through YouTube, Instagram, Facebook, TikTok, LinkedIn, and all of our social media platforms. Together, we unite to make more smiles. If you have questions or concerns about this video, please contact us directly at www.straightsmilesolutions.com. Enjoy the video.
This is Dr. Amanda from StraightSmile Solutions, and today I'm going to be going over how to set up your Invisalign clinical preferences. Now, quick disclaimer, this is how I would set mine up. This is how I help my clients set theirs up. That doesn't mean it's necessarily the right way for you. So every orthodontist that you talk to might have a different way and a different translation, So I think you shouldn't stress out about it, to be really honest. This is just kind of what this stuff means. And I know it can be very overwhelming, especially now if you're taking the online class to get certified for Invisalign. I know I've heard it's just a lot of really marketing stuff, and then they just kind of say, go, So first thing I would do once you get your Invisalign account set up is I would set up your clinical preferences, and then I would start looking for good cases. That's something that we can totally help you with. If you go to straightsmilesolutions.com, we can explain to you how we can help you in a one-time meeting or in a series of meetings to get find you a good case and get you rolling. Often they have some promos where after you get certified, you have a very small window of time to complete some cases at a very good discount. I think they're around $900 to $1,000 per case instead of the normal $1,800. So I think that's an awesome deal. I think if you're planning to get certified, it's a good idea to kind of have your cases banked and ready to go. That's what I initially did when I first got certified. I had 3 ready to go. So once I got certified, and back then we had to fly to get certified. Now you can do it digitally, which is great. But that way you can roll them in and get moving on them. So maybe it's someone in your family or someone in your practice that's a friend. It's a great way to get started, is to treat people who are willing to let you be patient as you learn, and maybe you can give them a little discount. Anyways, all right, so as soon as you get your account set up, you're going to want to go ahead and set up your clinical preferences. They might give you some defaults that they recommend. This is just what they mean. So I'm just going to kind of translate it, okay? So global clinical preferences, okay? So again, each case is different. So even though I like to have as generic as possible of preferences, because I might give feedback on each case when I'm submitting it as how I want it. So I don't really want the preferences to be a default on everything, because every case is unique, right? So, but the preferences are just there to save you time. Okay, so tooth numbering system, that should be self-explanatory. How do you like to talk about your teeth when you refer to them? Are you a general dentist in the US? Are you an orthodontist in the US? Or are you international like the rest of the world? So whatever works for you. It's funny because we didn't even learn this FDI numbering system at all ever. So I finally figured it out. It actually makes a lot of sense. But obviously mine's on Palmer because I'm an orthodontist in the US. But, make sure you're speaking the same language. If you don't mark that, you're going to be speaking a different language. If you say tooth number 2, if I say 2, it's different than what a general dentist would say 2, right? Or 22. Okay, passive aligners. What does this mean? To me, if you want to have passive aligners, it just means that you're going to have an equal amount of aligners, okay? So if one case is, let's say the upper one is 15 stages and the lower one's only 5, I wouldn't want to say none of the above, because then you're only going to get 15 on the upper and 5 on the lower. So the question is, do you want the lower treatment to be done first and just have some placebo or dummy aligners to match it up? Or do you want to just slow down the treatment to match it? So either way is fine. Most people pick this one as the default. Okay. IPR on the first Clincheck treatment plan. Again, this is really up to you. That's if you need IPR. What I do is the way I want to see my aligner patient in as few appointments as possible. Okay. So I put that as a yes. But if you're a new doctor, you might not want to say yes on that because you might want to kind of slow down those first appointments so they aren't so overwhelming. But then you're going to have more appointments. So either way, what you decide to do. If you decide to delay your IPR, okay, you can delay it to any stage you want. Okay, so the default again would be no delay. But if you want to delay it, you can delay it to 2, 3, 4, 5. You just have to remember that the patients are going to have to come back and get that done. So some people like to do their IPR once they straighten the teeth first, okay? Because it's easier. Because doing IPR with crooked teeth can be kind of tricky. Although I have a great IPR video that you can access. And if you need access to it, let me know and I can send it to you. But there are systems out there that can be pre-curved. So it's really easy to do IPR at stage 1 as opposed to stage 10. So either way. But some people will delay their IPR till it's a little bit straighter. But they'll keep it consistent. So they always say do IPR at stage 5, something that's easy to remember. So that means they're going to give their aligners first visit and have the patient come back for a longer visit to do the IPR. So either way, it's whatever you want to do. Okay. Same thing here about attachment placement. Okay. Do you want to delay the attachments? And remember, attachments are the little handles that move teeth. Okay. If you do not have attachment on your case, you can ask for no attachments, but that means the case might be less predictable in how it moves, or you may need a lot more aligners in order to move it. So, because it moves a little bit slower. And certain movements may not be possible, like extrusions or very rotated teeth may not be possible without attachments. Obviously, we see this in the direct-to-consumer aligner companies. They don't have attachments. So not all movements are possible, and it takes a little bit longer. So the question is, attachments placing can take some time. So do you want to do your attachments all at the first appointment when you deliver along with the IPR, or do you want to spread it out? So some people will pick no delay. Some people will choose to delay, say, to stage 5. I wouldn't recommend delaying attachments. If you're going to delay something, delay IPR. I wouldn't recommend delaying attachments. I would just get it done the first visit. That's my opinion. So that way you can kind of break it up. You do the attachments and the delivery and the instruction, so it should take no more than an hour. And then you can delay the IPR, say, to stage 5. That's a good idea. Or stage 2 or whatever you want to do. If you do stage 2, that means they need to come back the next week. So you may not have the space in your schedule. So better to delay it a little bit longer so you have the space to schedule it. Okay, extractions. Again, I probably wouldn't delay for that. If you're going to delay for extractions, I would just get it done. Okay, Pontics. So the question is, do you want full-size Pontics? So in this one, they're going to put full-size Pontics automatically if you have a space bigger than 4 millimeters. And if adjacent teeth are being moved, then they use half-size Pontics and they kind of fit them to fit. So this is probably what I would use. Just let them pick the right size Pontics. You don't have to fill the Pontics. You can buy Pontic paint and you can fill it so it looks nicer. It's a nice thing for the patient, but they don't do that automatically. So you'll have to buy that. It runs about $30 or so. You can get it from Alliance. I think that they also have it at the Invisalign store. You have to shade match though. So, and you have to light cure each individual aligner if you do that. And you have to open the bags. So it's a little gross. So, I mean, I would ask the patients first because sometimes they don't like it. Arch expansion. I would recommend marking this because that way you get arch expansion everywhere and not just the front teeth. That would look kind of silly if you do that. So, how much expansion do you want for your default? 2+ or less than 2? I generally like 2+. I'm a fan of expansion for younger patients, but if it's a perio patient, then it's going to be this. So obviously you're not going to change your global preferences. So you just have to remember, if you're marking this, then if you have a perio patient, then you're going to say, please limit arch expansion on this case, or don't do any arch expansion on this case. So you just have to remember what your preferences are going to be, because that's how the setup's going to come. You're going to get these cases that look super wide, and maybe you don't like that. So risks, of course, are recession, mobility, thin tissue. Invisalign, just like any other aligner company, they can't predict. They're not looking at the perio. They're not looking, even if you send them an x-ray, they're not looking at it. So you need to know, if you see a treatment plan, just because the computer says it's possible, it doesn't mean it is possible, first of all. Doesn't mean it's possible for them to get that kind of width. Or maybe it's not predictable, or maybe it's not healthy. So the technicians have no idea. So you need to really think, okay, just because the computer and the little video game says we can do this, is this the right thing to do for my patient? And that means doing a full exam, doing a perio exam, looking how the teeth move, and really thinking about it. Okay. Tooth size discrepancy. This one can be a little bit confusing for a lot of general dentists. So we're not always born symmetrical. Very few people are, okay? Same thing with teeth. So teeth are meant to fit together like cogs on a wheel if you'll have all the right size teeth. But a lot of people have tooth size discrepancies. Most common one is going to be obviously number 7 and 10, the laterals, peg laterals, small laterals. We see those all the time, right? Followed by, well, of course, wisdom teeth, but we don't care about those. Followed by premolars. They can be funky shapes, sometimes funky sizes, and they don't fit together right. So sometimes you don't know. I mean, obviously, I can look at a case now, and for the most part, I can predict a tooth size discrepancy, even a minor one, on the front end, and I feel pretty confident, like, oh, just by the way, your laterals are a little smaller than they're meant to be. So I know that it's not going to fit together ideally if we try to close the spaces. So we're going to have two options. Either we can leave some extra space around your lateral incisors, and afterwards you can get a veneer or a bonding or a crown, or we can extract a lower central incisor or do some lower IPR. Obviously, extract the lower central incisor would be for severe cases, to reduce some of the tooth mass on the bottom so that we can close all the spaces equally. So obviously it's going to come up in the treatment plan. It's going to be like, oh, why do I have space there? Or why can't we close all the spaces? So basically you're just telling them on the front end, what do you want to do if there's a tooth size discrepancy? Do you want them to leave space distal to the laterals? Do you want them to leave spaces equally around the laterals, or do you want them to do IPR in the opposing arch? This is tricky because actually I wish that there was another option than this, because that's not something that I would necessarily do any of these as a default, but I'll usually have my default be IPR on the opposing arch, because what I find, usually for laterals, I'll do 1/3, 2/3, so 1/3 mesial, 2/3 distals. Well, that's not here as an option. So if I mark this, then I end up with tiny spaces sometimes with Invisalign that I can't even see on the setup, and I don't even notice them until the patient's gone through treatment. She's like, why do I have a little space here? Oh, it's because of this, right? So if you put IPR in the opposing arch, then you'll basically know if you get IPR, it's because of this, for the most part. Okay, upper arch tooth leveling. So that just means a lot of people want all the incisal edges leveled, laterals leveled with the centrals. I don't like that. I like laterals 0.5 millimeters more gingival than the centrals. That's just my personal style. Some general dentists want them always to level gingival margins. Gingival margins can be adjusted. So every patient's unique. It's hard to say, but generally this is going to be my default, and I might change things. Aligner trimming. Basically, they have a couple options here. It's really up to you and how you like the trim to be. Most people, I think, do trim aligners to the CEJ line. Some people want to trim it halfway between the gingival margin and the CEJ line. So, if it's a perio patient, some people will do that. Virtual C-chain, I generally don't do it. That just means that they're going to overcorrect. But I tend to get extra crowding, so I say no to that. Terminal molar distortion. This is really pretty rare if you're doing scans. They're basically saying, if we have a distortion, what do we do? So I would just go with a default. They're just saying that they'll remove the distal portion and they will trim the aligner, just to make sure it seats. Just to talk about distal molars a little bit, this is actually a big deal. You want to make sure they're not going to know. They're not looking at your x-ray if you submit it. They're not counting teeth. They're just working with what you give them. So you need to make sure when you're capturing a scanner impression that you capture all the distals, all the teeth. So if you have 1 through 32 there, you need to capture 1 through 32, unless you're going to extract them before treatment. Um, I would always capture at least a half of the terminal molar, if not preferably 2/3, if not all, would be better. And certain types of movements, if you're doing distalization or if you're closing posterior spaces, you have to capture the whole tooth or it's not going to work out well. So, it's just better, good practice just to capture the whole tooth and make sure that you're giving them exactly what's there. Don't assume that they know. Okay. Optimize attachment size. Don't get in the weeds with this. This is really just let them pick the right attachments for the case. Let the software do it. Don't overthink it. Don't put all kinds of weird things on there. Just say regular size, regular size. We don't need to have gigantic attachments. Patients are going to hate you. Occasionally you have a patient where you need to do that. You're just stubborn, but just let them pick the default ones. Okay. AP correction. This is where people start to get really confused. AP correction just basically means patient has an overjet. For the most part, it's going to be, or it could be negative overjet, underbite. What do we do? So I tend to I like precision cuts. So if you just have attachment, you're not going to get a precision cut. A precision cut means it's a slot or a cutout so that you can put a button on it. That's the best way to correct AP. So I usually say place a precision cut along with a conventional attachment. I don't want a precision cut instead of an attachment. I want an attachment plus a precision cut. You'll start to understand what optimized attachments are and non-optimized attachment. Conventional, basically, this is their way of saying optimized is proprietary attachment. It's ones that Invisalign owns. Conventional attachments are just your regular rectangular or square attachments that everyone can have. It doesn't matter if you have ClearCorrect or one of these other companies. So again, stage to start precision cuts, I always start them at 1, but up to you. Special instructions, if you had something, I don't put those on for defaults because every case is unique and I don't want them just to blanket treat every case the same. All right, so the rest of this is all about Invisalign First, which is their phase 1 treatment. Not that many general dentists are doing that. And that's personally, I don't think you should be doing it with aligners unless you have a ton of experience in phase 1 first, because you need to understand phase 1, you need to understand growth modification. You need to understand, there's so much you need to understand about treating little kids. I would start with braces first, or at least with functional appliances like expanders and stuff, and understand phase 1 before you move on to doing this, because I think you're going to screw it up. And it's expensive too. So there's no reason to do this right now until you've done a few other plain aligner cases first and maybe some regular phase 1 cases, and then you can move into that later if you want to. That's just my opinion. But anyways, all right, that is how you set up your preferences for Invisalign. If you have any questions, we'll be glad to help you. You can visit StraightSmileSolutions.com. We have a ton of resources there. We also offer every dentist a complimentary consultation. It's free. So we say complimentary, that's free. Then you just go to our website and click in the top right-hand.
Dr. Amanda with StraightSmile Solutions, and I'm going to do an updated video on this topic. It's always good to update it as time goes on. So we're going to talk about submitting an initial Invisalign case, what to do, what I recommend. This is something that I take my StraightSmile Solutions clients with. We do this one-on-one at our first visit if you are an Invisalign provider. And as always, I do StraightSmile Solutions does support doctors with any kind of orthodontic system, except for direct to consumer at the moment. But so it doesn't matter if you're using Invisalign, white label, ClearCorrect, 6-month smiles, traditional straight wire, fast braces, which isn't my favorite, but I do help with it. Phase 1, airway appliances, blah, blah. We help with all that. If it exists in the US, we help with it, and probably abroad as well. But anyways, let's talk about submitting an Invisalign case. I do recommend that every provider should be an Invisalign provider. More and more now, I'm getting doctors that don't want to be, which to me is still, I realize that you're upset, and I realize that there are other options, but there's still a lot of benefits to it. I realize that they may not take your scanner type, which is very frustrating. There's a bunch of workarounds for that. I'll be glad to tell you how to do that. But there's a huge benefit to the Invisalign SEO. Having that on your website, you cannot advertise it on your website if you're not a provider. You cannot advertise it on your website if you're doing bait and switch. You can't advertise it on your website if you're not going to offer it, because patients going to come in off the doctor locator and they're going to be like, hey, thinking they're getting Invisalign, and they're not going to really necessarily understand if you're offering them a white label or, a generic brand. You have to be very transparent about that. It is an option, right? So anyways, in order to get on the doctor locator, I think you have to do like 3 cases when you first get started. And then in order to get up to silver, which is where you want to be at the bare minimum, you have to do 5, I think in 6 months. And that's 5 comprehensives. There'd be 6 moderates, etc. So one of the biggest mistakes that I see doctors make is that they get super stressed out. A long time ago when we first started Invisalign, our treatment territory manager or whatever we called them, reps, would come help us set up our portal. That's not something that happens anymore. So you're pretty much on your own. Sometimes they'll have someone help you, like an international doctor, but from what I've seen, they don't do a good job at setting it up. So if you're interested in having help with your portal setup, we can do this as just a one-time meeting, very small fee for that. So you're going to go ahead and hit submit a patient, put the patient's information in. Then you go hit next. I think I might have to actually write this stuff in to get it to do it. So let's do that. We're just going to make up a name. Goodness, SpongeBob Square Pants. Spelled it wrong. Great. He's a female. Birth date is 1901. Sorry, this takes a few minutes. All right. You don't have to put the patient contact information in. That just gets your patient some spam. All right. Oh, they don't like my date of birth. Not cool. All right. All right. You have to say where you want it shipped. Oh, come on. Okay. So you don't have to fill this stuff out. I mean, to be honest, I don't even bother unless there's something special that they don't know about. They should know all this stuff, but they say you have to. So mostly you can just say hi. They're not going to read it anyways. Okay. This is where you're going to upload photos. So you do need to have your regular orthodontic panel of 8. If you want to know more about doing that, I have videos on that, or I have infographics I can send you. Just email me and I'll be glad to do it. I'm going to hit later. If you want to use the Invisalign photo uploader, that's a great hack. It'll go straight to your account, which is like crazy easy. I would totally recommend it. Problem is, at this moment, you can't use the Invisalign photo uploader for other stuff. So just FYI. In terms of x-rays, if you have them, I would submit them, especially if it's not like a super easy case. Or if you want some roots uprighted and stuff, you definitely should do that. You'll get a better outcome if you do that. So here, if you have a scanner, it's going to go ahead and connect, and it's going to find names that are similar, and you can click it. If you do not have a scanner, you can click PVS impressions. Okay. So right now, I believe Invisalign's only taking iTero and maybe 1 or 2 other scans that are connected. Everything else is a no-go. So there are some workarounds about it. I'm not going to tell you how to do them on these websites because I'm going to get in trouble. So talk to me directly and I'll tell you the workaround. It's not that super easy, but I think it's better than not. It's still more accurate. You get all the benefit of the accuracy and from the positive patient experience with your scanner. I wish that Invisalign would change things. I think that it's not cool. I mean, I'm pretty out there about it. I realize that they make a scanner and they want you to buy their scanner. They claim that it's not as accurate, but I've seen thousands and thousands of aligner cases, maybe not Invisalign cases, but with your Medits, your Hurons, all these other trios, and they're fine. Come on. So they're smart enough they can figure out how to make this happen and not upset patients. And I mean, I think that was a big mistake, but we won't get on that soapbox right now. All right, so go ahead and start your prescription. They're going to go ahead and ask you to pick a type. Now keep SwearPants. Keep in mind, this is the general dentist portal, not the orthodontist portal. So it's slightly different options if you are an orthodontist. So they're going to ask you to pick adult, teen, or child. Let's talk about the difference. Adult is supposed to be 18 and up. Teen is supposed to be, I don't know, do we call it? Are we calling that? To me, teen is going to be like, I want mostly adult dentition. I'm going to submit this as a comprehensive case, not necessarily 13. Child for me is going to be a phase 1. So doing anterior alignment only is what I'm doing for this one. I'm going to need more braces later. If you're doing that, if you have any questions about that, let me know. The benefits of picking teen at this moment is that it's its own badge on the doctor locator. So once you've done, I think it's like 5 cases, you get a additional badge. I know that sounds kind of silly, but it's another search term. Like if a parent is searching, I have a teenager, and then they search, only the doctors that are experienced in teen come up. So you want to get your 5 done so that you get that badge. At the moment, they don't have that with the phase 1. It is something that I've requested, so I'm sure it'll pop up soon. But adult is self-explanatory. So as long as you've done that 3 or 4 cases, whatever, you'll come up as an adult provider. So let's go ahead and just pick adult. Okay. So for adult, a couple options come up. I strongly recommend, that you only pick this. All right. I definitely don't recommend this, Invisalign Assist. And Go is okay. The problem with Go is that it does give you some support. So if you have a consultant like me or some of us that are out there that will help you with it, then you always pick this, right? It's more affordable and you get better movements, better alignment, better cases, better outcomes. In terms of your outcomes, it's way limited here. With these, it's just going to be anterior treatment. It makes it very clear, like you can do this. With IPR, they kind of help you a little bit and they give you a few clear options, but they're not going to move back teeth, fix bites, anything like that. Okay. With this one, same thing. They won't use a lot of the features. They will have somebody help you. It's like an international doctor or something like that. But the outcomes are awful from what I've seen. I have yet to see a good one. And it's very limited what you can do. And you're going to pay more with the assist than you are with the traditional. So it makes no sense to me. So I would not ever pick these personally. These are retainers, right? So that's self-explanatory. So let's go ahead and pick that. I would always pick comprehensive. The biggest mistake I see is that new doctors are picking these other guys and then they get stuck because when you have oopsies and redos and things not tracking, everything's going to cost you money. You get a little bit of freebies and I think it's a little confusing. I think you get, 1 set of additional aligners, 1 set of additional aligners, 1 refinement available for purchase. Okay. 1 set of additional aligners included, 1 refinement available for purchase. So that means, listen, when you first get started, unless you have all your systems in place, you're going to have oopsies, makeups, refinements, revisions, mid-course corrections, unless you're working with someone like our team. So just expect it. So you want to have as many do-overs as possible. So try not to be cheap here and never dictate to patients. Like don't let patients dictate, oh, I only want a light. No. So we'll go ahead and submit it through comprehensive, okay? And then we'll make it the setup really, really good. We'll see what it takes, how many aligners it takes. And usually I'm going to add another 30, 40% because I find that cases track way better when you slow them down. Just a little hack. And ultimately you're using less aligners anyways because you do it right on the first try. So nothing wrong with that. If patient is super compliant, you can always speed it up. So, but let's start there. Everyone's a comprehensive in my book. Anyways, everyone should be dual arch. Almost never am I going to do a single arch unless like the patient was edentulous or they had like 5 implants and 2 bridges. Bites or they're getting a complete, full restoration on the lower arch or something because the bites just don't work out if you do single arch and you're going to end up taking more time and it's going to be costing you more. I almost always treat full arch, not anterior only. There's no benefit to that. Okay. So just do that. In terms of preferences, that's a whole nother story. I can kind of walk you guys through that in another video. Let's see. This is where you're going to block out anything that's bridges, ankylosed teeth, implants. Okay. Mark them if you have them. Maybe one that's super perio-compromised, something like that. Attachments. Mark out the teeth that you don't want attachments on. So those would be ones, again, maybe ones that have fragile enamel. I do them on anything that is a crown, a bridge, a veneer, or a buccal composite, because that's going to be frustrating for the most part. I mean, you might have to do it if it's a tooth that needs it, but try not to. Okay, next. Okay, AP relationship. Again, this is my translation, okay? So this is where you need to think about this. Obviously, if you're using a simpler product like an Express or a Light, you can't fix AP anyways. AP means the bite, right? From front to back. So either an overbite or an underbite, or, overjet or underbite. So if you want to improve that, then you're going to need to click one of these buttons, okay? And if you're clicking and canine relationship only, then most likely they're going to be using IPR to fix that area and not elastics, okay? Elastics are not scary, but I don't think you should jump into them unless you know what you're doing. So feel free to buzz us on that. If you don't understand, this is a little too complicated to explain on a YouTube video. So, and it really depends on the case. So, give us a buzz if you want to understand more about that. Okay, overjet, you know what that is, aka what patients call overbite. I usually have almost all my patients just as show result because I just want to see what it looks like initially, just straighten it and show me what it looks like. Then I'll decide what I'm going to do. Okay, same thing here with overbite. Unless it's like a super open bite case or a super deep bite case, I'm going to mark these. Otherwise, I'm just going to say show to get started. Bite ramps. I use bite ramps on any patient that has a deep bite and or any patient that shows evidence of parafunction, bruxism, clenching. I find that these ones, if they are having parafunction, nocturnal parafunction, that they will actually cause intrusion of their posterior teeth with the plastic. They actually push it down. It causes a force. And then you end up with this posterior open bite. And almost every doctor that's done Invisalign has had a bunch of these cases. I have a great video on how to deal with it. It's a separate video. Feel free to ping me if you're interested. But by putting bite ramps on either a parafunction case or on a deep bite case, it helps not only with the bite, but help to prevent posterior open bite. So that's what that's for. Okay. Midline, I usually just hit show. I don't always know which way I want the midline to move until after I set the case up. In terms of posterior crossbite, this is one of my biggest beefs with Invisalign. They sometimes will, if you hit correct, they'll just like show correction. Theoretically, the software says you can do it. That doesn't mean that the patient's mouth can accommodate it. That doesn't mean the patient's bone can accommodate it. That doesn't mean the patient's teeth can accommodate it. That doesn't mean it's even like healthy for the patient. Okay. So unless you know what you're doing, hit do not correct. I don't want you correcting. And even on kiddos, I completely disagree with correcting cross bites in a phase 1 case in a kiddo with Invisalign. I think it's wrong. You need an expander. So, and then go back and do it. So pretty much standard, my answer is do not correct. Because if it's an adult, I'm most likely not going to do it. They can have surgery if they want to correct it. It's just not usually that stable or healthy or even possible. I usually have it all straight down as my default as needed. Okay. Why? Because I want the software to decide. Now, only time I would change that is maybe in a kiddo, like maybe 13, 14. I'm going to err more towards expansion and proclination and IPR as needed. If it's an adult over age 40, I'm going to err more on primarily IPR and expand and procline as needed or none if it's a real perio patient. So just things to keep in mind. That's kind of where I toggle it. So obviously, again, another thing, just because the software says it's possible to straighten these teeth without IPR doesn't mean it's predictable, healthy. It doesn't mean that the teeth won't devitalize. It doesn't mean the teeth won't come out the buccal plate. It doesn't mean the teeth won't get loose and fall out and need implants. You are the dentist. So you need to know your patient's bone level. You need to evaluate the crown to root ratio. You need to evaluate the patient clinically, the thickness of the buccal and the lingual bone. Is this possible to do this? Is this healthy if I expand it 3, 4, 5 millimeters, transversely? I've seen so many cases, not just Invisalign, that just were messed up afterwards. All different brands, and it's really the dentist's fault on this. It is because you should know that that's not healthy for your patient. It's not the technician's job. It is not the software's job. Just because the software says it's possible doesn't mean it's healthy for the patient. I can't reiterate this enough because I've seen so much damage caused by ignorance. And I guess dentists think they're trusting the software. And Invisalign saying, you're the dentist. You tell us what to do. We'll just do what you say. Okay. So they're just doing what you say. So, use your brain. If you're not sure, run it by somebody who knows more than you. Okay. Extractions. Obviously, again, I can't read it enough. If the patient has third molars, you need to capture them. If they're erupted, they have to be captured. I would not capture them or pull them. Either way, if they're not beneficial to the patient. So it's real hard to do that in an impression tray. So that's just a benefit of a scanner. If you're planning to have them extracted before delivery, then you can go ahead and mark them off here. Extract these teeth, right? Just go boop, 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 Boop. Same thing goes. What else is common? I mean, I've done a few premolar extraction cases with Invisalign. It works out fine. It takes a little while. Lower incisor extraction cases, etc. But that's where you'd mark those. Next. Special instructions. This is just if you want something super special. Like, for example, you've got a little space around the area of number 5. You want to upright number 4 and 6 so that you can place an implant in there. You want the implant to be minimum 9 millimeters, something like that. Put that in there. So they're not mind readers. Anything super special, if you're going to restore a tooth afterwards, otherwise they're just going to do what looks best. And also in terms of special instructions, I would not have all kinds of special instructions in there. A lot of people just like cut and paste random special instructions that they got from some orthodontist of theirs or some friend. I'm telling you, this just confuses the text. It confuses the text and it slows down your case like crazy. So I would leave that blank unless there was something special. Do not just have like generic special instructions on every patient. Again, this is where you're going to link your scans if you have them. Next. Again, now they're asking me to upload my photos. I don't have them. Okay, so that's pretty much how far I can go because I haven't linked my photos yet. But you're going to go ahead and submit the case. And then, a couple of days later, if it's a scan, you should have your setup. If it's an impression, it's probably going to take a couple of weeks before you have your setup ready. Again, scan cases are going to track better. You're going to have better outcomes. It just is. It's way more accurate. It's digital and not analog. So if you can do a scan, it is recommended. If you're going to get into aligners, you should just get a scanner. It's not that expensive now, and you can use it for a million other things. So talk to me if you're interested. I'd be glad to. There's a lot of great deals that are out there as low as $500 a month, which is a no-brainer. You can use it for everything. Who wants to have impressions done? Nobody. So, and there's nothing worse than getting a patient all jazzed up about Invisalign, doing the impression, and finding out it's rejected, which will happen about 50% of the time. So I don't care how good you are. And the patients get mad. So it's not worth it. It really isn't. All right. So that's pretty much it. Basic take-home takeaways is submit every case as comprehensive, see how it goes, and you can always downgrade it later based on how compliant you think the patient will be. And maybe what are if you're using something less than comprehensive, what systems do you have in place for tracking, for compliance for the patient? Because the first 5, 10, 15, 20 patients, they're probably not going to go perfect the first try, unless you have someone super helping you out. So it's going to get expensive. A lot of doctors end up picking expresses or lights, and they end up paying way more than they would have for comprehensive, and they regret it. They're like, oh, I wish I knew about that. No, submit them all as comprehensive. So anyways, hopefully that helped you with your case submission. I have all kinds of other hacks and suggestions to optimize your Invisalign outcomes. And if you're interested in saving on lab fees and trying something else, we've got that for you too. All right. Thanks so much. Don't forget to visit StraightSmileSolutions.com and keep those questions coming. Hey, this is Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and I want to talk to you a little bit today about IPR. And you can see here the scroll bar down here, okay? So these, for example, these IPRs must be done, these 3 sites, by aligner number 2, okay? So you need to pay attention to when your IPR turns yellow on your treatment plan, right? So you go like this, okay? And you play it, and you see those have to be done by 2, and these have to be done by 10. Okay, can you see the difference there? All right, 2 and 10, okay? Now that doesn't mean that you necessarily have to do it at appointment 2 and at aligner 10. It just means you need to do it by aligner 2 and by aligner 10. Now it's probably going to be slightly more accurate. So Invisalign will tell you to do it 2 and 10, but I'm telling you, I do this all the time. It's fine as long as it's done by. Now, let's say I had like a 50 aligner treatment plan and I had IPR staged at 40. Okay, would I do it at aligner 0? No, probably not. I would do it as close to that when it's due, but it has to be done by the time it's due. It's like a library book, okay? Just remember that. So you have full control over the staging of your IPR on your treatment plans, okay? So if you see your patient normally in office at, every 6 aligners, then stage your IPR at 0, 6, and 12. You kind of get what I mean? You have full control over this. You need to use an IPR system that's going to work if the teeth are rotated. So I definitely recommend the Garrison Fit strips. I don't recommend you using like a burr for that kind of stuff, because you're going to get all messed up if you do that. And you should definitely watch my IPR video before you jump into that. You can find my IPR video at gpwebinar.com. Hopefully it's helpful for you. But yes, you have full control over your IPR. You need to finish the whole site. So if this is a site right here, this 0.3, this must be done. Was that the liner 2? I think that was the liner 2. That must be done, or that was the liner 10. Yeah. You must do the whole 0.3 millimeters though. You can't do it in increments, okay? And it must be done by the time it's due. I can't say that enough, okay? And remember, you have control over the staging. It's awesome. With some other clear aligner companies, it has to always be done at 0, okay? But these with Invisalign, it's pretty awesome. So. Hey, this is Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about the Invisalign MA feature. And I haven't made that much content on it just because I haven't been totally thrilled with it, and what I've seen, it just hasn't wowed me at all. And I can do the same thing with a appliance from any local lab, ortho lab, and do it way better. So I'm going to talk about it a little bit, and it is an option, and there's always options is basically what it is. So initially when they first came out with their MA, it was only available in the Invisalign First aligners. And personally, I think those are overpriced at, I don't know, what are they, $1,100 or something like that. You get 18 months to finish it. It's only for fixing bites and aligning 2 to 2 basically in front. It's an alternative to a 2x4, but you can do phase 1 aligners with ClearCorrect if you want to. They'll do it. I've done it. You can do it with white label. You can do it. There's so many different companies that will do it. They just don't market it as a thing, and it's way cheaper, like a fifth of the price, like crazy cheaper. And a lot of them do have bite turbos and other stuff and precision cuts and all the bells and whistles. So I have a hard time with the price of that. I know they discount the Invisalign Second by a teeny tiny bit, but ultimately with retainers, you're almost at $3,000 on lab fees unless you have volume discounts. And that is just way too much for plastic as far as I'm concerned. So for that reason, I don't love it. Invisalign First, but it's an option, right? Also, I've seen a bunch of cases done by quite a few doctors, and they all were terrible. Like terrible outcomes. Like they all needed revisions, refinements. I think that clearly Invisalign they didn't have enough cases under their AI. This is just my personal opinion. And they're accepting cases that needed expanders first. That really was the key. Once you expanded them out first, then it worked out. But at this point now, what's your lab fee? Think about this. You got expanders or an expander plus the Invisalign First. Well, once you start Invisalign First, the patient's going to want Invisalign Second. And now you got a couple different sets of retainers in there. So now your lab fee is what, $3,500? That is just not possible for the average American. It's not possible. So I still think there's huge opportunities for other people to get into this space with early treatment. There's a lot of good appliances out there. Some are way overpriced and overpromising stuff. Some are underpriced and people don't even know about them, but there's a lot of cool stuff you can do. Anyways, so what the point of today's conversation was to talk about MA. So my issue with MA is now I like that they did incorporate it into Invisalign Comprehensive. I like that. So I'll give bonus points for that, because for the most part, I'm going to probably want to do this in a comprehensive case. However, remember, if you watched all my videos, if you've read my hand-wrist instruction about how to read hand-wrist x-rays, about how to tell if a patient is what stage they are in their skeletal growth, if timing is key to using MA. And the problem with the MA to me is that in order to get a good outcome, there's this pre-MA phase and then the MA phase and the transitional phase and this, and they build this all in for you, but they don't know. Invisalign technicians have no idea if your patient is still growing. That's your job. You got to ask the questions. You got to get the growth charts. You got to take the hand wrist. You got to, my phase 1 smile that I created is a huge thing. You got to do something like that. You have to know if this is even going to work on your patient. That's not their job to make it work. It's your job to make sure you're picking a good candidate, and they're not going to screen your patient for you. So remember, in girls, if they're done growing at 8, 9, They may only have 7 teeth in. This is not going to work. It's not going to do anything. All it's going to do is nothing. So, if your patient is done growing, this is designed for growing kids, and that's your job to make sure that they're growing. I can't say this how many more times. And don't just assume that they're 9, that they're still growing, because they may not be. Boys probably will be, girls may not be. So timing is huge. Also, when you do it, and if they've got a deep bite or a bunch of rotations and some other stuff, they have to do the pre-MA first. And the pre-MA is for big deep bites, molar rotations, class 2 div 2, crossbite correction. So all this stuff has to be done first before they even start the MA phase. Well, if growth is an issue and you're getting close to growth maxing out, you're losing your window of opportunity. So for me, I would rather do some other appliance like a twin block or a bionator, or there's all kinds of other U-concept, class 2. There's so many different removable appliances that are very affordable. You can do first, harness the growth, fix the overjet, and then do braces or aligners. To me, that makes more sense. Okay. But it's not all in one go. It's 2 separate things. But just FYI on that, timing is huge. So anyways, that's my issues about the MA. It's still a thing. It's just case selection, and knowing where your patient is in their growth stage. But it's still an option, right? For growth modification. There's all kinds of tricks and tips, and patients that are mouth breathers, it's not so great on. They recommend doing all these kind of precision cuts and elastics to loop them tight at night. I don't know. I think there's better ways and more affordable ways, but always good to have options. So that is kind of my diatribe on the MA. And there's a reason why I don't make that much content about it, because I just don't really care for it. Hey, this is Dr. Amanda with StraightSmile Solutions, and today we're going to talk about Invisalign MA, Mandibular Advancement Feature, which is quietly now available with the comprehensive Invisalign. So I'm pretty excited about this because it is an option for small mandibles. However, they have almost no education with this. It's literally super sad what they have available, I think. I've watched everything that they have, and I've met with their team in their little training one-on-one sessions that they have. And I still don't I get it. Don't get me wrong. I get it, because I use MA appliances all the time. I've used bionators. I use twin blocks, activators, anything that repositions a mandible I've used, in ortho. I get the concept. However, I don't fully get all the preferences and how to integrate it into your Invisalign case yet. And like I said, I've watched everything, talked to everybody. And if I'm confused, everyone else is confused too. So, they're making this intentionally extraordinarily complex. So I'm going to try to pick it apart the best I can. I've seen some cases, but all my cases were owned by Align Technology. So I don't fully trust those cases. I've seen some cases get started, but they were all phase 1 cases with the MA, and they actually didn't work out at all. With different doctors, I saw their outcomes, and they were bad. So it was terrible. So I haven't seen anything good work out yet that was done by an independent doctor. I'm not saying it's not out there. It just means I haven't seen it. So if anyone who doesn't lecture for, work for Align Technology and has no direct affiliation for Align Technology would like to meet with me and show me your cases and your Clincheck and your outcomes, you have to make it all the way to the end. You can't just, it can't be the beginning. And literally it's going to take 2 years at least to finish one of these cases. And since they just added it to comprehensive, no one probably has any, unless they were beta testers, which means they all worked with Align Technology. So it's going to take me 2 years before I fully get this. But anyways, you get where I am with this. So literally everyone's so confused about this. I'm going to walk you through the preferences, how to submit a case, and what I think it means. It doesn't mean it's right. So, okay. So in order to opt in, it's secret. It's super secret. It's like going to Starbucks and ordering one of their secret drinks, or going to Chipotle and getting one of their, oh no, I know, better one, In-N-Out, and getting one of their super secret combos that's not on the menu. That's how I kind of think of this. So if you want to opt into this, and people are like, what? I didn't even know this existed. When you get to this section in submitting your comprehensive case, it cannot be a light, it cannot be an express. I don't even think it can be a moderate. It needs to be comprehensive, either teen or adult. I don't know why they let me do this for adult, because I clicked it adult. and it came up, and they really shouldn't have this come up with adult. Now that I think about it, it should really only be an option for teen. So that's a mistake on Align's part. I just thought about this after the case because they don't necessarily look, the birth date that in my fake patient, the patient was an adult that I put in. The patient was 19 and yet it came up. So Align Technology, if you're listening to my videos, which I know you actually do, and I'm honored, you really should only have this come up as an option, in my opinion, if the patient is like 14 or 13 and under or something like that. There should be like blazing signs saying, wait, this only works in a growing patient. That's just my opinion, because people don't fully get that. And they have 0 lectures on this. Like, you need to understand, I'm going to give you my whole like growing, non-growing skeletal maturity lecture here. Patients is only going to work on a growing patient. Some girls are done growing at 8 or 9. Some boys are not done growing until they're 15, 16, 17. You're not going to know just by asking them. There's some questions you can ask them. We can go into that. It's on my phase 1 smile screening form. I've got videos on it. This is like a 20-minute conversation. It's a little sensitive in nature. So, but you can't be embarrassed to ask these questions. Also, if you don't want to ask the questions or to supplement the questions, take a hand wrist x-ray. I came up with my own screening form on how to interpret the hand wrist x-ray. If you have a ceph plate, you can take a hand wrist x-ray. And to be honest, you shouldn't be doing this if you're not taking a ceph, because this, I would say ceph is standard of care for this case. As a matter of fact, I would love to see Align Technology have a place to upload the ceph and help you with it. I think that would be really cool, because they should interpret it and be like, hey, if your SNB isn't this, then we probably shouldn't be using this or something like that. It's just like diagnostic. It's standard of care for this type of case to have a ceph and to have ceph numbers. But of course, they don't teach you that. So anyways, okay. So if you want to opt in, you need to click instead of maintain current, as you submit the case, you need to click correct to class 1 canine and molar. When you click that button, it'll come up with a variety of options. You need to click the MA button, right? So your options are posterior IPR, elastics, distalization, some type of combination of both. That's usually what we do. Those are fine if the patient's done growing. You're tipping teeth, you're making space, you're retracting, you've got anchorage, blah, blah, blah. You're distalizing, or you can do an MA. MA is mandibular advancement. That means they're stimulating the mandible to grow. Well, the mandible's only going to grow if there's still growth potential. Are your feet growing? Have girls matured? Have boys voice change? There's all kind of signs and symptoms. Take a hand wrist, etc., etc. Okay. So once you click into that, then it's going to give you a couple of defaults. And I don't necessarily agree with all these defaults. And we're going to kind of dig into this stuff a little bit more in a second video that I'm going to do after this. But this is the defaults it'll do. It'll do edge to edge position. I'm fine with that. We'll explain it more later. It's going to do 2 millimeter incremental advancements to the MMA phase. Recommended. I'm fine with that. I don't love this one. The default is shift lower arch to improve midlines. I don't like that. So I would click this one, and I'll explain it more in another video. Lastly, precision cuts. Defaulted is no. You might want to put yes. We'll talk about that more next time. Okay, so anyways, that's how you do it. Not all cases that are MKA cases will be accepted, and they do tell you that. So you do not want to necessarily promise your patient that they can get the MA feature. This is where it gets a little confusing. So if you have a patient, small lower jaw, some crowding, of course, I would always use expanders first to expand out any real skeletal expansion problems. If they can use MA, they should be able to use expanders. So often these things go hand in hand. Do that first, then hold them, then scan them, and then you can start the Invisalign. If something happens and your case is rejected, there's a bunch of reasons why your case will be rejected. There's a bunch of fine print. Then you need to come up with another way that you're going to fix the overjet, which could be elastics or whatever. But if the patient thinks they're getting growth modification, then you may need to go consider first doing something like a bionator, a twin block, an activator, or something like that to stimulate the mandible for 9 to 12 months first, and then scan for Invisalign. However, patients may not like that. So I don't know. I think you just need to be transparent with the parents and let them know that cases aren't always submitted. There's a very tight algorithm. Cases aren't always accepted. And if it's not accepted, you can always come up with a different plan. Anyways, that's pretty much the basic overview on MA for Invisalign. All right. Thanks so much. And then remember, again, as far as I'm concerned, doing Invisalign on a growing patient that's having teeth coming in and out all the time is a huge pain. I would rather wait until all their teeth come in, or if they're a phase 1, if they're in that latency period where 2 to 2 is in top and bottom and they're not going to lose any teeth for like 6 months, perfect. That sounds great. But otherwise, I don't like to do Invisalign on patients that are losing teeth right and left. So that's just my personal, it just seems like a huge waste of time, even if you have an iTero, for you, the patient, especially now with COVID. Oh my goodness, what a hassle. So remember, the average patient gets all their teeth in by about 12, 13. Could be 11, could be 10, usually 12, 13. The vast majority of 12, 13-year-old girls were done growing ages ago. So that's not going to work on them. So the way I see it is it works better, the MA, if you either use it on the Invisalign first, which means you're going to pay twice. You're going to have almost a $3,000 lab fee between Invisalign first, Invisalign second, and 2 sets of retention on a girl. Or if it's a boy, it probably will work fine on a boy. And that's just unfortunate, but that's just how it is. Boys are often, they don't hit their growth spurt till 13, 14. Usually their teeth come in before they hit it, and it's perfect for them. So I see this as a good option for a male. However, boys aren't always very compliant with aligners. So, but sometimes they are. I can get one to be if they want to be. So, it's ultimately picking the right patient. But I'm going to tell you again, I'm just guessing based on what I read, your average MA case, by the time you actually finish, is probably going to have maybe 60 to 90 aligners. I mean, it's going to be 2 years at least. So, because there's a bunch of different stages, and we're going to go over that shortly in the next video. So you need to be transparent with the parents. This is going to be a very long haul. It's no different than if you were doing growth modification on a patient in braces. It would take 2 years, right? So same thing. There's a lot going on. You're leveling the bite, you're taking out the rotations, then you're doing the MA, then you're taking another scan and doing the finishing improvements. And if they didn't fully get it, you're going to use elastics, et cetera, distalization. So there's a lot going on. Hey, this is Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and hopefully you watched my first video on the Invisalign MA feature. I would say you definitely need to watch that video before you listen to this video, or this is going to make zero sense, because I'm not going to repeat everything and bore you guys. But basically, I dig into the defaults and how to submit a case through Comprehensive for MA, what type of cases would be good, how it works. And now I'm going to dig in a little bit more to each of these individual defaults and what they mean, based on what I think. So listen to the disclaimer in the first video. So basically, we went through this, how you can even opt into it. It's kind of like a secret sauce, how you get it. Okay, so let's go over the first one. So once you click that you want to do it, it's going to take you to the first one, which default is edge-to-edge position. I think that's good. I think you should pick that one. I agree with their default on that. Basically, what they're saying is that that's basically the way it works, whether you do like, I don't know, even if you think sometimes you do a sleep appliance, like it might take you to edge, or it might take you a millimeter past edge to edge or whatever. It works similar. But I wouldn't take it too much because you might overgrow that jaw. So I think edge to edge is more comfortable for the patient. And I agree with that default. So the next one is the MA staging. And if you click on the Learn More button, like right here, this is where these prompts come up. And again, please watch the first video because I have a lot of disclaimers in there. But in terms of the MA staging, I like the way this works because every, I think about 8 aligners, it does a 2 millimeter increment jump, like a bite jump. So that way it's not like, let's say you have a 10 millimeter overjet. It's not like, whoa, all of a sudden it's taking me to edge. That may not be comfortable. That may be extremely uncomfortable for the muscles. It's going to cause a lot of muscle fatigue, a lot of headaches, pain. Might displace the joint. So by doing this in tiny little 2 millimeter increments every 8 aligners, it's very gradual. Okay, so that's what that is. I agree with that. There's other ways where you could just have a full bite jump, but I wouldn't recommend that. I recommend that. So they're explaining the default here and how it is with the jaw jumps. Now remember, on average, it's going to be about 26 aligners just in the MA feature, just in the MA stage. And that's not even the first stage, okay? So they'll take you through it. If you watch their videos and stuff like that, the first stage for an MA case, and that is even if your case gets accepted for MA, just because you're picking and marking it doesn't mean you get it necessarily. It has to fit their algorithm. And remember, please listen to my previous video because this is only going to work if your patient's still growing. And and they have all kind of rules about how many teeth need to be in. So basically you need a patient that's pretty much in permanent dentition, but who's still growing, which means it pretty much is not for girls, because I don't know that many girls that are still growing. Very few, maybe 20-30% of girls could qualify for this if they're incomprehensive. Vast majority of boys probably will qualify for it. So watch all my other videos on growth, skeletal growth, how to assess skeletal growth. Invisalign is not going to read your ceph and tell you if this is good. Invisalign is not going to tell you if your patient is skeletally mature. That's your job to know all this stuff. And I did say that I think personally a ceph and ceph analysis is standard of care if you're going to opt into this feature, which is why I think they're purposely making this complicated, because it's really mostly just for orthodontists. They'll let you use it if you're not one, but you could really screw something up. Okay, lastly, or second to last, we did the MA staging. Then there's this weird asymmetry movement of lower arch. Sorry, it's super small. I would not have them fix midlines by moving the lower arch asymmetrically. I don't like that at all. I think that you should just fix the bite and grow the jaw. And then if there's an asymmetry in the midline, you should move the teeth with IPR, elastics, or whatever. I don't like that. So I would remove that default and take it down here to this one down here. So don't use the default on that. I'm not comfortable with that at all. So they said by default, the software will rotate the lower arch in the transverse plane. Oh, I do not like that idea at all. If necessary, to shift the midlines to up to a couple millimeters. You can override this default by selecting that the attempt should be made, sorry, this is super small, to improve midlines transversely. Okay, anyways, don't pick that. Pick the lower one. Okay. Lastly, precision cuts. I don't love the idea of this MA appliance on a mouth breather. So they do have a way that you can put precision cuts in and loop elastics at nighttime to keep them from opening up or to help them keep it in their mouth. Kind of makes sense. I certainly would never use it on a tongue thruster. I can see you doing this on a mouth breather. However, I think there's so many better appliances for mouth breathers with small lower jaws. I'm not loving this at all. So I think if that is your problem, that's the least of your problems. And I feel like you're slapping a Band-Aid on something to try to fix something the wrong way. But that's just my opinion. And I think also the precision cuts are going to pull it out of the mouth because they won't let you bond it to the actual teeth because of the wings. And you can't loop the elastics around the wings, they said. So anyways, and then here's all the patient inclusion criteria. So they have all how many teeth have to be in, how much overjet, blah, 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 clinical crown height, width. I mean, your patient may be rejected from MA. It is a relatively new feature, so don't promise it. Say maybe you'll qualify for it. And if they have a teeny tiny little jaw and you didn't get approved, then you need to come up with another plan. And remember, it only works if they're still growing. So MA is the second stage in the 4 stages of an MA patient with Invisalign, okay? So the first stage is going to be leveling and aligning, getting out all the major rotations, fixing the deep bite. So you may have 10, 20, 30, 40 aligners of that. Then you're going to have minimum 26 aligners of MA. Okay, so now we're at somewhere between 40 and 60 aligners, okay? At 1 week a pop, maybe faster. And then they recommend that you stop, scan, and do a refinement to tweak any, overjet, get the midlines on if you need to do that, and fine tune any little things that need to come in, 12-year-old molars, all that. So, I mean, I think probably an average MA case, because most patients that have small lower jaws, they have all kinds of other problems too. The small jaw is not just the problem. So realistically, I think you're probably looking at 70 to 100 trays for a case like this. I mean, this is a good 2-year case, which is normal for a hard or a more challenging ortho case in braces. That's what it would be. So I don't know if it's going to be any faster than braces, but great. I mean, if you didn't tackle, it's just another reason, benefit to support doing phase 1 treatment. I mean, you really should have tackled this in phase 1, but I think it's a good value. If you've still got a growing patient and most of their teeth are in, I think it's a good value to spend $1,870 on a lab fee and do it all in one go. If I had a growing boy that had all their teeth in, I'd do it, with an overjet. So, I would love to definitely see some cases if any of you out there have finished one and you do not work for Align and you're not a lecturer for them. Amanda from StraightSmile Solutions, and today I wanted to tell you a little bit about a new Invisalign product that just came up on their portfolio. It's called Invisalign Moderate. I actually welcome this because this is something they actually really needed. So just to let you know the difference between the options out there, I think they've got a nice graph right here. Let me show you. So basically the Invisalign Moderate is going to be very similar to the Invisalign Comprehensive, except for it's $174 cheaper than the Comprehensive, and it's only up to 20 aligners, or it's 20 aligners or less, I think. So, and it comes with all the bling that you wanted from Comprehensive that you couldn't get in Go and Light. So you get mostly for me, the huge thing is the precision cuts and the bite ramps is a huge deal. So I think the catch, if I had to say there's a catch why I maybe wouldn't use it, is that this is the catch: additional aligner policy. One set in 2 years, okay? One set. Whereas Comprehensive is unlimited for 5 years, okay? And you get a little less points. So for $175 difference, it's a little bit risky because they don't really go over how much the additional set is. Oh, maybe this is it. Is it 130%? Let me see if I got this. Regardless, it would have to be a very compliant patient for me to use this on. I think it's a huge risk for $175 to shorten down your treatment time to 2 years. I mean, granted, if you have 20 aligners at 1 week per aligner, you should be done in 20 weeks, theoretically. You need to have a really good compliance system in place. This is very easy to do. It's not hard to set up a compliance system. Check out my other videos on that. But I think it's a matter of letting the patient know that, I would build this into your compliance contract. Honestly, if they need to save all their old aligners. They need to be checking in with you weekly on changes, at least virtually through some apps. There's all kinds of apps and systems that you can use to check in weekly, making sure they're totally tracking, not progressing unless the aligner's tracking, using their chewies, not moving forward unless you give them the thumbs up. So use a turnkey system like dental monitoring, use another system like GP Ortho Tracker, GP aligner tracking system. There's all kinds of stuff you can use. Again, for saving $175, I'm not sure. I'm not sure that it's worth it. But, it's there. So good to know. Good to think about. So any questions, make sure you give us a buzz. If you got any questions or you want to learn more about something, thanks for bringing this question in. We appreciate it. All right. Again. And then, lastly, I think what is really cool though about Invisalign, they do have their digital class now. That was a huge deal. I think that they released it. I heard there's like zero substance to it for those people who've taken it. So make sure if you don't understand, personally, I think anyone who's doing aligners should also understand braces and brackets because you really can't understand how teeth move unless you've done some cases. So you should be doing all this at one time. So if you want to learn a little bit more about StraightWire, we do have hands-on StraightWire classes, destination and digital, and we'll be glad to teach you. All right. Visit StraightSmileSolutions.com or email us at info@StraightSmileSolutions.com.
Dr. Amanda here with StraightSmile Solutions, and we're going to go ahead and jump into the new Invisalign pricing structure. This is not a surprise. Invisalign raises their prices every summer for the most part that I can remember, so I kind of expected these would roll out. I have to give them credit. Thank you so much for giving us they gave us 2 months notice, 3 months notice. I can count today. So that's great. So that you have time. The good news is they're giving you a courtesy notice so that you have time to get all those cases in to save your money. Get them in before the end of the quarter so that you can save a ton of money. So got questions, need help? Don't forget to go to StraightSmileSolutions.com. We'll be glad to help you get those cases in and get you up to your next level in the Advantage program. But in any case, let me take you a little bit through these portfolio of options because they've changed a little bit. And this is the email that they send out to the general dentist. I didn't see the one that went out to the orthodontist. I'm assuming it's the same prices, but not. Orthodontists do not have all these options. So it's a little bit different. So, and I really love how they compare and contrast the two options. So Invisalign Comprehensive is AKA what was Invisalign Full and Invisalign Teen. Same thing. They just rebranded it. Okay. So it is going up just a little bit between now and July. Invisalign Lite has been around for some time. That is your 14 or less aligner system. It is about $600 cheaper. There's some limitations, so choose carefully if you think it's a light case. Got questions, feel free to ask me. Invisalign Go is a new option. I did a really big blog post on it, so go ahead and jump into my LinkedIn or my website, go to blogs if you have any questions, and you can read all about Go. This is I think this is the best value, in terms of what you get as a general dentist for a simple anterior case. This is a really, really good value, so you should check it out. Invisalign First is not available for general dentists. It wasn't before. This is for phase 1. Remember, I think it only goes up to 18 months. This is how you're going to access their MA or mandibular advancement feature. It's now available to general dentists. I haven't personally tried it yet. I've done tons of mandibular advancement cases with Twin Block, which is my appliance of choice, and some other ones that are out there, but it essentially works very similar. So usually what I've done in the past is I've used Twin Blocks, which cost me maybe like $200. And then I advance and expand as needed, and fix the bite, because you can also design Twin Blocks to open bites, close bites, stuff like that. And then later, as needed, I'll straighten the front teeth at the end of phase 1 or later in phase 2. So I do the same thing, all different ways to go around it, but this is all together in one. Invisalign 10, we've had that around for a long time. Again, there's limitations. I don't think with 10 you can't have precision cuts, you can't have rubber bands. There's limitations on revisions, refinements as well, and certain types of movements. And I think torque is not available, last I saw, in some. That's assist. It's not available. So assist does have a lot of limitations too, just to let you know. What else? Invisalign Express, I believe that's your 5. They call that now as Express. Assist with progress tracking and assist without progress tracking, that is also in my portfolio. Again, assist is limited, and you have to check in every 10 or so aligners with a new set of scans or impressions. So it's great if you need feedback. However, I like to say StraightSmile Solutions offers you the exact same thing, except you're not working with a tech. Or you can work with DM Dental Monitoring. They offer the exact same thing, except for you don't have to take a scan or impression, you just take photos. So lots of other options if you don't want to pay an extra $200 and something for progress tracking each case. You can pay a lot less. Just a suggestion. Compliance indicators, I don't think that's really necessary. There's much better ways to measure compliance. So anyways, so glad to go over this package with you. Don't forget to visit some of our websites, StraightSmileSolutions.com. Visit all our blogs and vlogs. We have tons of YouTube videos on the subject. We also do complimentary webinars every few weeks. They're free. A lot of this stuff is free. We offer every doctor a complimentary consultation. We'll talk about your services. We're not going to go over cases. We're just going to talk about what you're doing, how you can do things better, maybe lower prices. Again, I just want to clarify, because sometimes people get a little upset. I'm a big fan of Invisalign. It is by sure, for sure the most premium product out there for aligners. It is the best for a complex case. For an easy, mild to moderate case, lots of options. So it's all how it works in your hands. So you have to have the skill set in order to make that treatment plan optimized. You can give me any aligner system for a mild to moderate class 1 case, and I'll make it all look exactly the same. Okay. And so I might save you $800 on a case, but that's in my hands. But I can train you to do it in your hands, is what I'm trying to say. But not every case is a mild to moderate class 1 case, which is why there's always, value to Invisalign. So anyways, I just wanted to clarify that.
Hi, this is Dr. Amanda with StraightSmile Solutions, and today we're going to be talking a little bit more about what Align Technology announced yesterday, which was their Smile Consult feature, as well as their virtual check-in feature. And the timing really couldn't be more ideal here. I've been nudging them for years to do this, so as well as many other companies are doing it as well. But these are exclusively available only for Align Technology Invisalign patients. So if you're seeing ClearCorrect patients, or you're doing white label aligners, or you're doing braces or phase 1 or anything else, you can't use this technology with that. But let's go over it. There's really nothing brilliant that goes into what they're doing. This is stuff that I've been doing with my clients for years already. It just so happens to be neatly packaged, and it does have AI that integrates with the Align Technology portal. So basically, you got your Smile Consult. I believe it's an app. that you can get from the My Invisalign app that the patients do. It allows them to log in, to chit chat with you, to consult with you, and they're basically using the Zoom platform. And so it's a great way to, still, if you're shut down or you're closed, you can still do virtual consults. You can still check in on your patients. You can even do progress checks, progress check-ins without the AI and answer patient questions. So they're going to be using Zoom, which is available to everyone. You can go get it right now. From what I can tell from what they said, it sounds like they're using the free Zoom, and free Zoom is junky. So because it's limited to 40 minutes, which may sound fine to you, but I'm going to tell you, I've done this before. And what's going to happen is patients are going to be running late. You schedule the appointment with Zoom, they run late, and then all of a sudden your meeting gets cut off right in the middle of it. And there's nothing you can do about it at that point. So I'm sure Zoom is giving it to them I'm sure they're paying something, but there's just so many licenses they can't possibly get a license for each doctor. That'd be incredibly expensive, but you can go get your own. So, I'm thinking, what do I pay for Zoom? I have a premium Zoom and I probably pay like $30, $40 a month, maybe a little more with webinar functionality, but you don't need that. So personally, I think I would go get it on your own, but it's up to you. This does integrate directly with the AI within the Invisalign app or whatever dashboard. But this is how you get started. You're going to have to bookmark this URL. You're going to have to accept the terms and conditions for both the virtual and the Smile consults. I've already done that and it's still not okayed or set up yet. So it takes a little bit of a while to do it. You can go ahead and create these virtual appointments. You can say how long you're going to want to do. It can't exceed 40 minutes. I would definitely book yours all at 40 minutes if you're going to use this service, because I'm going to tell you what's going to happen. If you do a shorter one, it's going to get totally cut off. So you got to put some basic patient information in. You can go ahead and create the appointment. You'll receive a confirmation. Patient will receive a confirmation. You both need to click on it. Zoom's really easy to use. I use it all the time. However, your patient has to also download the software on their end, which is not that hard. But your patient would need to be kind of quasi-tech savvy. However, many companies right now are using Zoom. So a lot of patients' parents probably already know how to use it. So you're going to get reminders and stuff like that. They're going to have the ability to change and cancel. This is how they edit their appointments. Basically, there's going to be a speaker view and a gallery view. Basically, you can turn off your video, turn on your video. You can mute yourself. It's pretty easy. You can share screen so that the doctor wants to share screen with a Clincheck, or a doctor wants to share screen with x-rays or anything. They can go ahead and show it to them. Besides that, let's see. They say they recommend 15 to 30 minutes. Max is 40 minutes. I already told you that. Who needs to be present? This could be just a doctor or the doctor and the treatment coordinator. The nice thing about this is that you guys could be totally quote unquote self-isolating, doctor at home, treatment coordinator at home, or in the office, patient at home, and you're still doing a consult. I would never make this be a binding consult if you've never met this patient before. Now, if you're a general or pediatric dentist and you already have an existing relationship, you've already done an exam, you've already checked out their dental health, well then, hey, you got to start right there. So that's the benefit for y'all. So there's some troubleshooting stuff. It's pretty easy. This is kind of their scripting behind it. Let's see. And then beyond that, we've got the virtual care. Now, the virtual care I'm definitely more interested in. It's basically just virtual check-ins. Again, nothing different than we're already doing with dental monitoring, with GP ortho tracking, and a lot of other people who are just using other forms of HIPAA-compliant check-ins. It's just that this is HIPAA compliant, and this is what I like about it. It links straight into your Invisalign dashboard, which is great because the doctors will get a notification. You'll go into your Invisalign portal, you'll log in, you can click on your patient and you can see their tracking photos. So that's pretty sweet. And the patient can just check in on their phone, which is totally brilliant. If I were dental monitoring, I'd be super pissed off right now because Invisalign was totally like best friends with them for many years and they basically just stepped on their face. But I could have told you that was going to happen. So, it's a great idea. There's nothing proprietary. Obviously, dental monitoring has the AI built into what they're doing. So if you're really busy, you want to use them because the AI is in there and it tells you things, without you having to even know it. But if you're not that busy, you can use Invisalign, which is just basically a
photo, and you'll just need to screen it, but it's free. So liner tracking, compliance, stuff like that. So basically, that's pretty much about it. But yeah, I'm really proud of Align Technology for rushing this, getting it out. This is fantastic. We need this. We really do. So this is the time. There's just no reason for everybody to be totally closing right now. There's so much virtual care that you can do. Patients want it. And if you're not offering it, I'm telling you, your patients are going elsewhere. I already know they are because I see it all the time. So they are finding another doctor to see. So if you can't get in the swing of technology, give your Invisalign rep a call or give me a call, and I'll be glad to go over what virtual consults are and virtual check-ins. And check out some of my other YouTube videos on the topics and all the other different options that are out there. There are a lot of different options out there. All right, stay safe, stay healthy, guys. And I will talk to you soon with my next video. And for the next couple of weeks, my videos until all this is over will be all about things that can support you during these next few weeks, different systems that can be done remotely, basically everything like that. So let's talk about it.
Hey, it's Dr. Amanda with StraightSmile Solutions, and today I'm going to talk to you about enrolling in Invisalign Virtual Care. They're a new program, how to be a beta tester, how to get your patients involved in the virtual care app, what the benefits are, what the risks are, and just all kinds of thoughts. Now, unfortunately, there's absolutely nothing I can show you right now because it's still in beta mode, and I did get trained. I did go to their webinar training today, but I'm not, as part of the terms and conditions, I'm not allowed to show you what I saw today. So sorry. So I'm just going to be talking and giving you kind of my thoughts and everything. You'll need to go to log into your Invisalign account. If you go on the top right side, I've got some pictures of it. So you can, if you have a question, I can send it to you where you're going to opt in. You're going to need to opt into virtual care. And then from there, you'll need to take the class. It was 27 minutes long. It was super fast. And then from within 24 hours, then you'll have access to enroll your patients in the virtual care program. Now, here's kind of some of my concerns. So I mean, the process is free in terms of what you're going to need to purchase. And they said for now, they did not promise it was going to be free forever. So that was a bit of a caveat. So that's one of my concerns. They clearly did not say it was free forever. So definitely a concern that came up. If I were Invisalign as a company, I would probably make it free with the comprehensive cases, and I would probably charge for it with the other cases. And that's, I mean, I can't tell you what they're going to do, but that's, given the tone to the answer on the webinar, I have a feeling that this is going to be a limited thing. So my concern is that you're going to be training your patients how to use this, getting them all to download this app, getting them all to register their personal information with Invisalign, which I know is going to be an issue. I see that as a major drawback already, that in order to have your patients be part of this virtual care, which is a benefit, that they have to download an app, accept the terms and conditions, put in their personal information in order to download the app, okay? Then you have to put in their personal information within the dashboard. So now Invisalign has a lot of data and if I was a consumer, I would not be happy about this at all. So to me, I was so psyched about this, and all of a sudden I'm no longer psyched about it. So, I mean, there's a lot of third-party apps that you can do that really have no interest in your patient's data. No interest they would not have anything to gain. And of course, I didn't see the terms and conditions that the patients get, because in order to see their terms and conditions, you're going to have to be a patient. And I didn't have access to that. So to me, that was like, yikes, yikes, yikes. No, thank you. I don't want to do this. So I'm just telling you that the option is out there. I don't think I'm going to use it with any of my patients, to be honest. Once I took this webinar, I was not impressed at all. I mean, technologically, I thought it was cool, but no. But anyways, I'm just telling you my opinion. You can choose to do whatever you want. So, and I'm sure I'm going to get all kind of nasty messages, but I didn't realize that was the way it was going to work. And I was quite disappointed, actually. But in any case, it's there. It's free at the moment. Like I said, you're going to have to opt into it. You're going to have to take the class, which was 27 minutes long. From there, you'll be able to select patients or whatever. You can invite all your patients. You have to select them. But in order to invite them to be part of the virtual care app, you're going to have to put in their personal information, their phone number or their email. Then they will get an alert where they're going to have to accept the terms and conditions, just like you did, whatever that is. And they're going to have to create an account. Now that's 3 steps. The way I can see this being easier is if at the start, like when you started the case at the delivery, then you say, hey, we'd love for you to do, we have a couple options. We have the virtual care option, which will reduce some of your actual appointments. Obviously, you have to do some benefits. It's going to be more convenient for you, stuff like that. We can give you more aligners at one time, whatever you want to do. Here, let's do this right now while you're in the chair. Let's have you with your parents download, set it up, opt in, accept terms and conditions. Because at this point, the patient's going to have to answer a lot of questions about where frequency. They're going to have to scan the bag on the bag of their aligners, the barcode, in order to add it or type in some information. I can't see patients doing this independently without you basically looking over their shoulder. It's just not going to happen. I don't know, unless they really, really wanted it. But I think the vast majority of patients are they feel very uncomfortable about having to do this kind of stuff. And also, here's the funny thing is when I look at the app I'm an Android user, so I don't know what it is in the Apple store, but in the Android store, the My Invisalign app has a 2.8 star. I never download apps that have a 2.8 star. I mean, I know it's not going to work right. It has terrible reviews. So I don't know. I didn't read all the complaints, but I mean, that's a problem too, just for Invisalign. Hopefully that they see that and they clean it up, because that's embarrassing that such a big company would have a 2.8 rating on an app. So, I mean, that clearly tells you that either there's a privacy violation, patients don't like the app. This is the patient-facing app. That's terrible. I don't know, whatever. But anyway, so that's the way it's going to work. Once they do all this, then they're going to put in their frequency of changes, like 1 week, 10 days, 2 weeks. And then the alerts are defaulted based on their frequency. And then what's going to happen is you're going to have to give them a retractor. It does not come with it. It can be any retractor. You can buy these in bulk. That's not a big deal, but it's just one more thing that you're going to have to do. And then if you're not seeing your patients right now because you're closed for COVID, you're going to have to mail them the retractor. So it's one more step that you have to do, which is not a big deal. But trying to get retractors right now through Amazon or eBay, it's going to take a good month. So they said you can use spoons, but that's fine too. I mean, you have to give them the information. They're going to take one 180-degree video that kind of spans across with their aligners in. They're going to take an anterior open bite photo with the aligners in. And then I think they're going to take a photo with the aligners out. 2 more photos. I think the other one's worth the aligners out, but you get the idea. From there, you're going to get an alert on your end, which is going to require you to log into the dashboard, review the photos, and then make a determination of on track or off track, which is basically like dental monitoring's version of go, no go. So it's the exact same: green light, red light. This looks great. Continue. Change to your next aligner, or stop. Here's some more instructions. Use your chewies, or they even have one that's like their version of backtrack. And I can't remember what verbiage they used, but it was like go back 1 aligner, go back 2 aligners, or come into the office. So from there, you'll be able to type something in. There isn't, as far as I can tell, not like dental monitoring where you can store certain default options that you can just select that sound like you. I think you have to type it each time, which might be kind of a hassle, but whatever on that. So like they said, this is not automatic like DM. DM, you're going to toggle up, toggle down. You're going to set your parameters, what things you're concerned about. And if things are good, it's going to use AI to say go, no go, right? This is going to be you guys logging in to a dashboard, logging into your Invisalign portal to look at this. It works very differently than if you're using something like Rhinogram, which is just going to be a message, or using GP Ortho tracking, which is going to be an HIPAA compliant email that comes to you, to review and respond. So it really depends on what you want to do. To me, this seems like a lot of extra work to have to log into the Invisalign portal and review the cases, but okay. So anyways, that's pretty much how that works. Like I said, at the moment, you're going to have to opt in, take the webinar, send your patients invites, have them accept the terms and conditions, have them set up the account, and then from there, you're ready to go. And so that seems like an awful lot of steps. It would be much easier if you could set it up right when they were in the office, but at least it's an option right now. Hopefully this was helpful. I think you should definitely opt in and give it a try. There's definitely going to be patients that will do it. I just think it's going to be a small percentage of patients. And I think personally, I still like GP Ortho tracking way better, because you could put GP ortho tracking right on your website, and you can use it not only for virtual check-ins, but also virtual consults. Two different things, right? And we know Invisalign does have a virtual consult option as well, but again, you know, it's a lot of steps to get in. So, I love the idea of patients going to my website all the time, because I can always put fresh content on there, and I can use my Facebook pixel, and it helps increase my SEO. And there's super lot of benefits to getting your patients to your website. Whereas using this app is of no benefit to me besides just the functionality of it. It's a benefit to Invisalign to get your patients' data. So, and AI. Hey, it's Dr. Amanda with StraightSmile Solutions, and today I wanted to talk to you a little bit more about the new Invisalign Virtual Care app, the new Invisalign Virtual Care Kit. And that's what I'm showing you here, is what the Virtual Care Kit looks like. It is $9.99. You can buy it from the Invisalign store. I do believe you need to take the class, or at least it was when I did it first. It's like an hour-long webinar to get certified in doing it. And that, I guess, primes your account so that patients can use this. They will need to download the My Invisalign app, and then they'll need to sync them from the app to your account. So there's like a little QR code there. They can do that. It's pretty easy. My suggestion is, if you're going to do this on all your patients, is to set it up on their phone when they're in the office, unless they're super tech savvy, because we found it kind of challenging. Maybe not for like someone who knows apps and text, but for an average consumer, we thought it was kind of challenging. There's got to be easier ways to do this. But yeah, I mean, honestly, what you're getting here, I mean, the on one hand, the use of the virtual care app is, as long as you're an Invisalign patient, is free. So that's good. And the pictures, and it does sync right into your portal, which is HIPAA compliant. And then you'll get a notification when they do check in on the regular frequency. So you can go into their dashboard, you know, and go into your Invisalign account and check it. But, you know, this is $10 per patient for this basic retractor, which you don't have to use. The one thing that's nice about this retractor is that it does have these kind of curved handles, so it's easy for them to retract the buccal segments. So you can get a nice picture of the bite in the back and stuff like that. That's the nice part about it. But I mean, honestly, you can buy retractors in bulk from eBay or Amazon for pennies per retractor. And you could, in theory, do that. I don't know whether you can use any retractor with this, or if you have to buy one for patients. So you guys are going to have to check that out. I think you probably can use whatever you want. But initially, when we first took the course, they told us to have the patients use spoons. So I'm assuming don't have to buy this, but then you're going to need to basically, so here's the instructions then basically, and you're going to need to set it up on your patient's phone. That would be the easiest way to do it before, like when you deliver the appliance. Now, beyond that, if you're looking for something else, personally, I think it's a huge hassle to have to log into the dashboard every time into the Invisalign thing, because you can't do this on a mobile phone. It's kind of a pain. You have to do it from your desktop. You got to log in. I mean, I realize it's HIPAA compliant. There's all kinds of other HIPAA compliant ways that you can do virtual tracking with a retractor. Same concept, except you can pay a couple cents for the retractor and do tons of patients. And it doesn't just have to be for Invisalign. It could be for any aligner company. It could be for elastic wear with braces. It could be for expander turns. It could be for functional appliances. It could be for retention. Could just be for alignment. Could just be to check, see if there's breakage on braces. I mean, I can think of a bazillion different ways you could do it. Of course, my favorite I talk about a lot is gporthotracking.com, because there's one setup fee, small. And I think it was discounted for COVID, so you might want to check it out. If I send you, you get even more of a discount. And there's one monthly fee, unlimited, one doctor, one office, as many entries as you want. And you can build that widget into your website. It's a really easy just drop. You just have your website developer drop it in. So the patients go to your website. You can create a special page on virtual tracking, and that brings your website traffic. And always when they're on your website, they can do other things too. I mean, who knows? Maybe you have a store, maybe you have other things, maybe you have blogs. That's going to help to boost your SEO. It's going to help to boost your social media. There's so much power behind going to the website. All this does is helps Invisalign. So, you know, there's really no benefit to you besides the convenience, quote unquote, of it. So anyways, that is my small diatribe about this. But hey, if you want to do it, go for it. I just thought I'd show you. All right. Thanks so much. Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk to you a little bit more about how you can work with us to optimize your Clinchecks. And you've probably seen that Invisalign, it's a little beef I have with them, has been actively advertising molars coaching. They're actually requiring you to use their coaching. I'm assuming they're an investor in it. Because why would you push it so hard? Otherwise, there's a lot of really great Invisalign coaching systems out there that are run by orthodontists that have lots of experience, that are cheaper, but they require you to use their system in order to get some of their benefits. But I want to let you know that we not only will help you with your Invisalign cases, but we'll help you with all your other aligner brand cases, all your straight wire cases, all your phase 1 cases, airways, sleep disorder breathing cases, any system. We have some preferences, but we'll use whatever you want to use. And if you don't know what to use, we can give you suggestions. So there's a huge ROI on that. And most of our plans, except for the very bottom one, which is just like purchase one case plan, which most people don't do. Most people purchase that and then get a subscription because they're like, wow, this is so great. It's unlimited support on unlimited cases, one doctor, one office. So we don't penalize you for doing 20, 30, 40, 50, 60 cases a month. Matter of fact, we encourage you to do it. We want you to learn how to do it. We want you to learn how to do it independently. We want to teach you. And then we want you to stop using our services and go fly and come back if you have a question, or downgrade and send us 5 more doctors, because you should be able to do this by yourself after a year. That's the goal. We don't want to be a drug. We don't want to be an addiction. We want to help you. Or scale, buy a new office. We'll teach your associates. So many different ways we can go with this. But I just want to let you know our core value is not to require you to use this on all your cases. Now, if you just want someone to do it for you and you want to be totally checked out, ultimately, we're not going to hit approve because we're not the licensed doctor. Okay. You're going to have to make the final decision. We'll optimize it. We might have questions for you. We still want to stay engaged, but we can do most of the work for you. This is the workflow. If you're one of those doctors, and that's, hey, no judgment. I totally get it. And sometimes, you're going to go on vacation. You're going to want to make sure your cases are still going through. Maybe you had a baby, you're sick. You don't have time to learn right now. I get it. Just let us know. So here's how you can go ahead. And this is kind of a new workflow. Before you had to make a distribution email. Now they let you have another notification. And you can either create a staff account for us, is a great thing, or you can give us your doctor login, whatever works for you. I don't really care because we're not going to look at your finances or anything else. All we're looking at is the Clincheck, optimizing it, and we're never approving it. So your choice. But if you just go to your doctor profile, and by the way, if you've never had someone look at your doctor profile, let's do a session. Let's look at it. Let's optimize it. You'd be surprised things that you don't even know that's there to optimize it, benefits you maybe don't even know you have. Look at it from the perspective of someone that understands Invisalign and the doctor profile. You can get so much more referrals and patients if you optimize this. Other thing you need to optimize, of course, is clinical preferences. You'd be surprised how many people have some wacky things click there, and that's why they're not getting good treatment plans. So we can tell you what to click so that you get predictable treatment plans the first time around. So go to the doctor profile, hit notification alerts, hit change. And then from there, you go ahead, enable notifications. So many people don't have that enabled. Oops. You have your email there, maybe your office email, your front desk. I would put that in there, and then put our email in there. Okay. There's a typo. info@StraightSmileSolutions, plural.com. Okay, don't do that. If possible, you definitely want to have review Clincheck plans, send additional patient records, clinical issues. Deselect most of the other stuff because it's junk. It's just like advertisements. And that's it. Hit save. But can't do this unless you're one of our VIP or concierge clients. Not premium, not a la carte. If you get it, we'll be like, bye. So it's only for VIP and concierge clients to be able to do this. And I'm telling you, we're going to flip these things around so fast, you're not going to know what hit you. These things are going to get done in a matter of days, not weeks. They won't pile up. If we have a question, we're going to ask you. So keep your eye out. If we have a concern, we're going to ask you. If we want to talk about it, the reason why we have to do this with VIP and concierge is sometimes we got to talk about stuff. We got to talk about options. We got to talk about risk, benefits, and alternatives. Sometimes we'll have a couple different versions we can work up, and you're going to want to show the patient. Always submit all cases as comprehensive cases. We can always downgrade them if we need to. But if you submit them as an express or a limited you will be limited in your outcomes. And I like to just have one set price for Invisalign. I don't like it when people have two different prices because things don't always go as predicted. I mean, very rarely is it ever going to just be a 5 or 10 aligner case. It doesn't work that way. So just have one price, and you can always have a white label price as well, or an off label. You can call that your express price. Do the express stuff with white label because it's way cheaper anyways. Or one of these alternative ST Express, StraightSmile. There's a lot of different ones out there. You're going to save a ton of money if you do it that way. Have an Invisalign price and then have an in-house aligner price. What are people charging for Invisalign? Maybe somewhere between, I would say, $4,800 and $5,500, depending on where you are. If you're coastal, big cities, you're going to do more like $54, $55. If you're in flyover land, small town, rural, maybe around high $4s. And then your white label price might be somewhere between low $3s, high $3s, low $4s. So that's my suggestion. You will make, and you can have a lower down payment with your white label because you're not really going to have a big down payment, So that's another option, another way to get people in to be your clients. So it's not a bait and switch. It's just two different options. We got branded and unbranded. All right. Thanks so much. Hopefully that was helpful. We hope to work with you more soon.
Hi, I'm Dr. Amanda, and I'm an orthodontist. I'm also the CEO of StraightSmile Solutions. We help dentists all over the world understand orthodontics better. We work with all systems, braces, appliances, and brands of aligners, and we support all systems and brands. This video will share content that is the property of Invisalign and Align technology. We've made this video upon request of 40,000 plus doctors, subscribers, and followers to help them achieve better outcomes with their Invisalign cases. We do not work for Align technology. All opinions expressed in this video are the opinions of StraightSmile Solutions and not Align Technology. Thank you to Align Technology for continuing to support us educating and helping their doctors and letting us share this video around the world through YouTube, Instagram, Facebook, TikTok, LinkedIn, and all of our social media platforms. Together, we unite to make more smiles. If you have questions or concerns about this video, please contact us directly at www.straightsmilesolutions.com. Enjoy the video.